Today, the state opened up vaccine eligibility for people 50 and older.
They're in Group 1C, but KXAN's Jacqulyn Powell found just because the state's saying those in that group are now eligible, that does not mean they're able to be vaccinated everywhere just yet.
Even with tens of thousands of shots going into arms across Central Texas every week,
there are a lot of Texans that need to be vaccinated. We're an awfully big state.
Thousands of people in phases 1A and 1B still haven't been able to get their vaccines. So some providers in our area say they'll need to catch up before opening appointments to people 50 and up. That's the plan at vaccine sites in Williamson County this week. There are about 12,500 people in 1B still on the county's wait list.
So since we are going to be getting over 17,000 doses of the vaccine this week through our vaccine providers, family hospital systems, and Curative, we should be able to get through everyone in 1B and be able to start on 1C towards the end of the week.
HEB pharmacies and community care both opened up vaccinations to the 1C group Monday, while smaller providers like Terrytown pharmacies say they're still not getting enough doses to do so. And Austin Public Health says those in 1C should go ahead and register on its site, but they can't sign up for an appointment just yet. APH is working out the technical details, saying it'll still prioritize those in 1A and 1B trying to sign up. But adding another large group to the mix, I asked,
will it be more difficult for them to get their vaccines if they haven't?
Well, it is always going to be more difficult, because it's the same allocation. And so that's why we're just asking folks to be very patient.
That's why APH is encouraging anyone now eligible to sign up with multiple providers and go with the first available appointment. Jacqulyn Powell, KXAN News.
Austin Public Health tells us it still has 235,000 people in groups 1A and 1B on its wait list. But APH says it's not clear how many of those who are registered may have since gotten vaccinated elsewhere. Nowhere near that number of people are actively trying to get vaccines through APH week to week. Last Monday, it was shy of 29,000, and the Monday before that, less than 15,000 tried. APH plans to roll out an update to its website later this week that will allow people to update whether they still need a shot, in hopes of getting a more accurate number of who in 1A and 1B still needs a vaccine.
The University of Texas says it has identified a new COVID-19 variant that originated in California through campus testing and monitoring in Austin. This is now the second variant within the UT community. The UK variant was identified last month.
A new CDC report says most people who were first eligible to get vaccinated have had both doses and on time. The report includes 2 analyses of vaccination data between December 14th and February 21st. The first looked at more than 12 million people who got the first dose of the Pfizer or Moderna vaccine. About 88% completed the series. Less than 4% completely missed the second dose. Another analysis of more than 14 million people who got the booster shot showed more than 95% did so within the recommended time period.